Welcome to the Loving Support WIC Peer Counselor Training Program for WIC managers, coordinators, and supervisors. This training has been developed through a cooperative agreement between the USDA Food and Nutrition Service and Every Mother, Inc. It is designed to help state and local WIC agencies implement and sustain successful peer counseling programs that help participants in the Special Supplemental Nutrition Program for women, infants, and children receive the help they need to reach their breastfeeding goals. The training program for WIC peer counseling program managers, coordinators, and supervisors provides program guidance based on the FNS Loving Support model, research on the evidence behind peer counseling, best practices adopted by state and local WIC agencies across the country, and solutions to address common challenges. State and local agency showcases are also included to highlight successful strategies. The curriculum is divided into 10 major sections. Each section is important for training new managers and for staff in existing programs to assure continued best practices in program management. Each section has an accompanying notebook and handouts. Feedback from participants during in-person training indicated the notebook was an extremely valuable resource. Both the notebook and handouts are accessible on the Maryland WIC SharePoint website. Please print each notebook section and the handouts prior to viewing the webinars so that you can follow along, take notes, and reference handouts as they are discussed. Welcome to Section 1, the evidence for the Loving Support model. The curriculum, Loving Support Through Peer Counseling, A Journey Together for WIC Managers, is intended for state-level WIC staff, local agency managers, breastfeeding coordinators, and peer counselor supervisors. It provides evidence-based practices for implementing, enhancing, and sustaining a successful peer counseling program. Section 1 provides an overview to help managers understand the vision and expectations of the Food and Nutrition Service for peer counseling in the WIC program and the evidence-based program requirements. You will need the handout entitled The Loving Support Model during this webinar. After viewing this webinar, WIC managers will be able to list the requirements of the Food and Nutrition Service Loving Support Model for managing a breastfeeding peer counseling program in the WIC program. This curriculum is designed for state agencies to train local agency managers and staff involved in managing peer counseling programs. It can be used for training new local agency managers as well as a refresher for helping local agencies sustain evidence-based program approaches. This section, the evidence for the Loving Support model, addresses the vision of the Food and Nutrition Service program for breastfeeding peer counseling in WIC. Why does WIC promote breastfeeding? As part of its mission to improve the health of nutritionally at-risk women, infants, and children, the WIC program provides breastfeeding information and support for participants. Peer counselors play a vital role in WIC, serving as role models for breastfeeding and providing mother-to-mother encouragement and support during pregnancy and at critical times during the postpartum period. This support is different from health professional to mother support in that the source of support is a peer, someone who is similar to the mother. A peer is viewed as an equal to the mother because she has experiences similar to the mother she is working with. The WIC Breastfeeding Peer Counseling Program has been funded since 2004 based on research showing the unique mother-to-mother support component helps improve breastfeeding initiation and duration rates among low-income women. This funding is available to implement and sustain peer counseling programs that operate under research-based practices as outlined in the FNS Loving Support model. The WIC Breastfeeding Peer Counseling Program is not meant to be a standalone program. It does not operate separately from the breastfeeding support offered by local agency staff. It is effective only when it is part of a comprehensive statewide strategy to promote and support breastfeeding. The breastfeeding peer counseling program provides an important adjunct to the usual WIC clinic services. Peer counselors extend the care of WIC clinic staff in breastfeeding support. They supplement but do not replace the work of CPAs, nutritionists, WIC designated breastfeeding experts, and lactation professionals. Peer counselors have the time to form relationships with participants and address the barriers and issues that might make it difficult for new mothers to breastfeed. Support from healthcare professionals is a different and important type of support offered to WIC participants in conjunction with peer support. When the breastfeeding peer counseling program was launched in 2004, it was preceded by formative research on lessons learned and recommendations from state and local agencies with existing successful peer counseling programs. The research formed the basis for FNS guidance to help state and local agencies implement peer counseling programs that are evidence-based and rely on best practices. The WIC program follows evidence-based program practices to assure fair and equitable access and best outcomes for WIC participants. Local agencies that implement a peer counseling program must follow these best practice approaches. This helps assure consistent standards across all agencies and greater program efficiency. Program reviews and assessments have shown they also contribute to improved breastfeeding rates. Let's take a look at the Loving Support Model now. Please have your handout entitled The Loving Support Model on hand and follow along as we briefly discuss each component. The Loving Support Model serves as the basis for manager training. It addresses program support in two areas: adequate program support from state and local management, and adequate program support of peer counselors. This training curriculum for managers is structured around each component of the Loving Support Model. Each section of the model will be covered in depth in its own webinar. The model allows for flexibility based on state policy as long as the core components of the model are met. The first component of the Loving Support Model is the definition of a peer counselor. While other professionals at WIC have valuable support and assistance to provide WIC participants, it is a peer who is able to fill a special niche that can only be filled by someone meeting that definition and serving in this specific role. What are the requirements to be considered a peer? She must be a paraprofessional, someone who does not have professional training in health, nutrition, or the clinical management of breastfeeding. Paraprofessionals provide specific tasks within a defined scope of practice. They assist professionals but are not licensed or credentialed as healthcare, nutrition, or lactation consultant professionals. She must be recruited and hired from the population your agency serves. She will be similar in characteristics to the WIC participants served by the agency. This could be speaking the same language as the mother or sharing the same cultural or ethnic background. She must have personal breastfeeding experience. She has to have personally breastfed at least one child. This allows her to empathize with the common breastfeeding questions of new parents. She must be available to WIC clients outside usual clinic hours and outside the WIC clinic environment. Support should be available to WIC participants when they need it most. Most breastfeeding questions arise outside of normal clinic hours. Peer counseling programs must have designated managers. Local agencies operating a peer counselor program must designate a program manager at both the state and/or local level and peer counselor supervisors. Research has found that programs operate most efficiently when a designated manager and supervisor are identified with a specific role of program management and provided dedicated support to peer counselors. It is imperative that peer counselors operate within a defined scope of practice. This is for the protection of the peer counselors by providing them with guidance in the way their skills can safely be used in the care of mothers and vulnerable infants. It is important for the safety and protection of WIC participants. It is also important for a local agency to reduce liability concerns to have a scope of practice that staff follow. FNS has defined the basic scope of practice for a peer counselor to be based on supporting normal breastfeeding. The loving support model requires local agencies to pay their peer counselors. This means providing a salary or wage appropriate to their position as a valued member of the WIC team. The issue of appropriate compensation is central to addressing equity within the WIC program by assuring that valued staff are adequately compensated for their service. State and local agencies should also assure training of appropriate WIC state and local peer counseling management, supervisory, and clinic staff using FNS loving support curricula. Training assures that program managers and supervisors are able to manage a program that is efficient and will make a difference in health outcomes for mothers and infants. State and local agencies must establish standardized breastfeeding peer counseling program policies and procedures at the state and local level as part of their agency nutrition education plan. While agencies have some flexibility in standards and policies to meet the needs of their agencies, the policies must align with the core principles of the loving support model. Peer counselors rely on receiving guidance, mentoring, and support from their supervisors. This helps them feel secure and supported as they grow in their peer counseling skills, and also assures that program standards are followed consistently. Program supervisors must receive training based on the FNS Loving Support curriculum to assure they understand the components of a successful peer counseling program. State and local peer counseling programs should establish community partnerships to enhance the effectiveness of a WIC peer counseling program. Community partners include local hospitals and providers who need to be part of the referral network, as well as other agencies such as Healthy Start, Early Head Start, and other programs that serve a similar population as WIC. Other partners include employers and other groups impacting WIC families in their breastfeeding journey. Establishing community partnerships builds a stronger team of support for breastfeeding mothers and enables the peer counseling program to be more effective. How does the loving support model support peer counselors? The loving support model requires that peer counselors receive adequate training and continuing education using FNS Loving Support peer counseling curricula. Training is essential to help equip peer counselors with evidence-based skills and to assure that they understand their defined scope of practice that aligns with their training. Training and ongoing continuing education also help peer counselors feel confident and prepared so they can be more effective in counseling mothers. FNS requires state and local agencies operating peer counselor programs to provide a WIC designated breastfeeding expert to handle complex breastfeeding issues that arise beyond the scope of the peer counselor. Peer counselors may not serve as local agency designated breastfeeding experts because complex breastfeeding problems are beyond their scope of practice. Just as the supervisor is crucial in providing mentoring, guidance, and supervision to peer counselors, it is equally important that peer counselors have regular, systematic access to the supervisor. WIC state and local agencies should enable peer counselors to participate in clinic staff meetings as part of the WIC team. When WIC peer counselors are part of the WIC team, they are less likely to feel isolated and alone and are able to support the work of the WIC clinic team more effectively. When WIC staff see the peer counselors regularly as well, they are able to value their role and improve the referral network to assure that the needs of WIC participants are met. The Peer Counselor Program is based on the strong and effective mother-to-mother support model, which shows that peer support makes a difference in a mother's feeding decisions. That strong peer support model is also needed for peer counselors to function effectively in their role. Learning from other peer counselors provides unique learning opportunities and helps build confidence as peer counselors grow their skills. It also helps reduce feelings of isolation that occur when staff work more limited hours and/or work some of their hours outside the clinic. How is the Loving Support model formed? As part of the original Using Loving Support to Implement Best Practices in Peer Counseling project launched in 2004, a comprehensive formative research process was conducted in all USDA regions of the country to identify successes and lessons learned. More than 125 in-depth interviews were conducted with WIC programs that provided peer counseling programs, those that did not, and those whose programs had been discontinued. Interviews were conducted with WIC peer counselors as well as non-WIC programs that provide peer counseling services. The research phase also included a thorough review of all known curriculum programs being used in both WIC and non-WIC settings, as well as comprehensive literature review of studies related to managing and sustaining effective peer counseling programs. The objectives for the research were to better understand the perspectives of both management and direct services staff, and to learn what contributes to the success and demise of peer counseling programs. Agencies with successful programs had these characteristics in common. They had program leadership and support from all levels of management. They had dedicated supervisors and program managers with designated time allocated to provide program and staff oversight. They had standardized training programs that included the local WIC clinic staff. They trained their peer counselors on WIC issues and policies and educated WIC staff on breastfeeding support, as well as the role and scope of practice of the peer counselors. They gave clear guidelines on peer counselor scope of practice and when to refer. Peer counselors had access to designated breastfeeding experts for situations that were beyond their scope of practice. They had adequate funding to operate and maintain their programs. They had methods to retain peer counselors, and this increased the stability of their program. Agencies that did not offer peer counseling programs shared these common concerns. They did not feel they had staff available to help manage the program. They did not think they had mothers who would qualify as peer counselors in their community. They did not feel that hospitals and/or local providers provided strong systems of support for breastfeeding families. They did not have a peer counselor training curriculum. And based on their lack of community support, they had difficulty forging partnerships in the community. WIC agencies that began but discontinued their peer counseling programs shared these common issues. It's important to note that we can learn just as much from these agencies, if not more, than we did from agencies that ran successful programs. These programs lacked funding to sustain the program. They used volunteer peer counselors, which led to high turnover rates. This caused staff time to be diverted to managing turnover instead of spending time supporting and growing their program. Programs implemented by a single breastfeeding champion meant when the champion left the program or moved from the area, the program left with them. Without local WIC staff trained in breastfeeding support or peer counselor role and scope, There was no understanding nor buy-in for the peer counselor program. These programs lacked systems to train and supervise peer counselors. They had no dedicated supervisors focused on providing mentoring and oversight to new peer counselors. Peer counselors were faced with doing their job in isolation. They lacked the guidance of a defined scope of practice and had no referral systems for situations they were not trained to handle. They had no consistent contact guidelines for reaching new mothers. Not surprisingly, these agencies saw that their breastfeeding rates did not improve and concluded that peer counseling did not work. However, many of these programs stated they would like to reinstate the peer counseling program because they believed in its value in supporting WIC families if and when they had the resources to support it. After the initial launch in 2004, the WIC program continued to assess the efficacy of the loving support model. Throughout 2010 and 2011, voluntary feedback sessions were conducted with WIC state and local leaders and staff about how WIC peer counseling programs were working, lessons learned, and best practices. These included expert panels representing different levels of WIC managers and direct service providers in all FNS regions, best practice discussions with 21 state and local agencies and hospitals representing all FNS regions, surveys with 9 state WIC agencies representing each of the FNS regions, and general feedback through posts, listservs, and communications through FNS regional offices. In 2016, a similar voluntary feedback process was conducted. These included expert panels representing both state and local agency providers in each FNS region, as well as external partners and community groups. Through online feedback forms, collecting voluntary feedback and ideas. And finally, in-depth interviews were conducted with 9 state and local agency representatives in each of the FNS regions and an Indian tribal organization. What did this feedback reveal? It revealed that the model works. Findings from all of these continuing feedback opportunities revealed that the loving support model, based on the original 2004 research, remains a strong framework for establishing, maintaining, and expanding peer counseling programs. The important findings from these information gathering opportunities are integrated throughout peer counseling curricula for both managers and peer counselors. They serve as a basis for lessons learned and recommendations. Training is pivotal to implementing and maintaining an evidence-based peer counseling program in WIC. Training allows program managers and supervisors to assimilate new information, understand program priorities, and problem-solve situations that might arise when managing the peer counseling program at the local level. This concludes Section 1, the evidence for the loving support model. Please continue on to Section 2, peer counseling, how and why it makes a difference for WIC families. Thank you for your participation in loving support peer counselor training for WIC managers, coordinators, and supervisors.